PBS series, Second Opinion, we have doctors who barely know each other discussing a case they've never heard about a patient they've never met, all with the patient right on the set. I'm the regular recurring cast member. I'm a primary care physician here in town. I practice internal medicine. And I like to think I'm a little bit different than those other more famous TV doctors in that I'm actually seeing patients every day from this community. And one of the things that worries me is some of the stuff I'm hearing from my patients about the information they're getting from healthcare media is a little bit concerning. And I'll give you 3 scenarios. The details change for privacy. We don't want the HIPAA police to come in here. The first patient is a 74-year-old woman who has severe heart disease, had 5 stents placed, and let me know that she had stopped taking her medication because a friend told her Dr. Oz said they were dangerous. A 62-year-old patient with a very aggressive form of prostate cancer informed me he was not going to accept any treatment except the vegetable smoothie he read about online. And the last patient, and this one I want you to remember, is a 56-year-old man who has been resisting treatment for depression who came in to tell me that he wants treatment now because he saw a doctor talking about it on TV.
In 2004, Oprah Winfrey introduced a new doctor on her daily television show, and his name was Mehmet Oz, Dr. Oz. Now, Dr. Oz went on TV on Oprah at almost the same moment as Second Opinion was premiering on public television, on the public broadcasting service. Dr. Oz had immediate popularity, and he built a media empire by dispensing health information to people on television. Second Opinion also had immediate success, but as you might imagine, in typical PBS fashion, with a lot less fanfare than Dr. Oz. The 2 shows had one thing in common, though. When they went on the air, media pretty much meant TV and radio. 1 year after Second Opinion premiered, Facebook was launched. 3 years later, Twitter came along. And today, consumers are deluged. We are literally bombarded with health information from thousands of sources. So it stands to reason we incorporate some of that information into our own healthcare.
And the problem is if that information is inaccurate, it can be problematic for physicians and nurses and other care providers, and it can be outright dangerous. The concern is that this is a growing market. And just to show that, in 2009, the Pew Trust and Kaiser Foundation did a survey of all health news coverage. And what they found was that 5% of all news stories was a healthcare-related topic. That's 1 out of 20 stories, and that's a 36% increase from when they previously looked at that. Healthcare ranks 8th out of all news topics. That's 1.5 times more than domestic terrorism, 3 times more than race and gender issues, the environment, education, even other science and technology. And when they asked them about their use of the internet, this is in 2009, mind you, 75% of those individuals used the internet to look for healthcare information, and 1/3 of the individuals used it to diagnose themselves, very often without ever seeing the physician. Now, that's one issue enough, but we're spending a lot more time connected to the media. We spend 1 full week per month connected to the media, some form of media, whether it's your phone, computer, television. I don't mean 8 hours a day. I'm talking about 24 hours a day times 7 days every month. That's as much as we work or we sleep. And the issue with that is the information that individuals are getting is being incorporated. And when you compare and contrast that to how much time you spend with your physician, when the CDC and when the Commonwealth Fund asked individuals, physicians, how much time they spend with their patients, so you know this is probably less. It's about a little less than 1.5 hours of time that you spend per year with your physician. Compare and contrast that to how much time we spend on the media. That's over 2,000 hours a year connected to some form of media. So physicians and healthcare providers are getting outgunned. And the problem with that is the information that individuals are getting from the media would be fine, except very often it's incomplete, it's inaccurate, it's irrelevant, or it's outright wrong. And to back that up, there was a couple of studies that were done in 2 prominent journals, in the New England Journal of Medicine and PLOS. And what they did was they took hundreds of news stories from dozens of news outlets and had a panel review that information and look at it and say, is it relevant? Is it accurate? And what they found was interesting, that 40% of the time, they never discussed the benefits of a medical treatment or drug. And how is that even possible? What are you talking about then? When they look at the drug in terms of side effects or adverse effects, more than half the time, they never discussed it at all. And interestingly, if they had an on-air expert who had direct ties, financial ties, to the medical treatment that's being discussed, that wasn't disclosed more than 60% of the time. And 2/3 of the time, cost wasn't even discussed. To get to the issue of relevance, the New England Journal, when they looked at this particular study, they had looked at a particular news reporter's report on Fosamax, which is a drug for osteoporosis. Some of you may be on it or have been on it. And they had reported that this was a miraculous drug. This is a major newscaster, that it reduced the risk of fractures by 50%. When you look at the actual risk for fractures in that group, it was 2%, which means that you reduced your risk to 1%. That's very different information that both physicians and patients would use when they have a discussion about that.
Of course, as patients, we want information like that, but few of us have access to or can afford the medical and scholarly journals where that information is found, where the business of medicine is conducted. We have and rely on the news media. We trust that information without realizing that in many cases it might be packaged just so the sources of it, television, radio, electronic media, can make and keep a relationship with us. But as a consumer, I'm not any more cynical about news media than I am about time in my doctor's office. I want more of both, and I'll keep coming back.
But the problem is that good marketing is getting confused with good medicine. And we in healthcare have known this for a while. The information that's coming from media very often is not providing the best evidence for the best outcomes. So somehow you have to get real patients with real diagnoses and real doctors and real science to somehow get into your living room. And then someone took the Rochester approach and said, why not do just that?
While Oprah was courting Dr. Oz for her TV show, 12 doctors here in Rochester were talking to WXXI about the possibility of a TV show for public television. They envisioned something that would be based in science, but that would be consumer-friendly, would bring doctors and patients together. And that's how Second Opinion came to life. The program brings together practicing specialists, Lou Papa, and real patients from all over the country to sit down and talk about their diagnosis and their treatment options. It's not soundbite journalism. It's not a Sunday morning food fight. What it is science. It is medicine. It is a discussion that's vetted by physicians, and it's vetted, importantly, by consumers. That's the important part. And it gets into the headlines that we often don't see. In fact, it gets past the headlines. Here's an example. This is Dr. Bob Lustig. He's from Harvard University, and he's very famous. He became famous because he made a video about how he thought sugar was poison, and that video went viral on YouTube. He joined Second Opinion as one of our specialists for an episode on obesity, and that's where he ran into Lou Papa.
And Dr. Lustig is a brilliant man, but I told him that we've heard this before. We've heard it about fats and saturated fats. We've heard it about carbs and refined carbs. We've heard it about sugar and gluten. What's next, water? And I said, what's the problem is that for my patients, trying to demonize a single thing as the cause of all ills leaves them disappointed every time.
And this is Dr. Mark Hyman. Dr. Mark Hyman is famous. You've seen him on the Dr. Oz show and on the Today Show. He was a specialist on Second Opinion's episode about naturopathic medicine, a perfectly valid topic. But Lou, you and he tangled on the issue of supplements.
I did. My Sicilian temper came out. We were discussing the use of natural substances to treat heart disease, and we were mixing up quite a bit. And finally, I just said to him, I said, Mark, I will shut up right now, which was very difficult for me. And I won't say another word. I said, if you can provide evidence, and you can say here now that your approach will reduce risk for strokes, heart attacks, and death, because I can do that. I can say that right now. And I had a beautiful 3 to 5 seconds of silence that answered my question.
And this is Congressman Tony Coelho, the author of the Americans with Disabilities Act. He was on Second Opinion as a patient with epilepsy. And he had a very revealing moment where he took our host, a well-respected physician from New York City, to task because our host was calling patients with epilepsy epileptics. These are never subtle discussions. They're multifaceted, they're multidimensional, just like real life and just like real medicine. On Second Opinion, it's okay if the answer isn't black and white. It's okay if doctors disagree. It's okay if patients have power and authority. And it's okay if doctors say, I don't know. That's why doctors love being on the show, and that's why patients come from all over the country to be on Second Opinion and to tell their stories, because they know they are going to be completely present in the conversation. And if you're not aware of it by now, those conversations are taking place right here in Rochester. Second Opinions produced by WXXI and the University of Rochester Medical Center. PBS picked it up immediately in its first season, and it's been on the air for 11 years. We're on 200 stations around the country. We're viewed by 1 million people every week. Last season, our digital and social media presence topped 10 million impressions, and it's won 24 national awards for health and science reporting. We're really proud of it.
What Second Opinion did for me, interestingly, which was unexpected, was gave me an idea that we underestimate media in medicine. We really turn our nose up to it. That patient I was talking about before, that 56-year-old patient that had depression, when he came to see me to say, I want treatment, because he saw a doctor talk about it on TV, the doctor he saw was me on Second Opinion. So you have this clear, my patient came to me to discuss his care because he saw me on TV talk about treatment to let me know I was right. The important thing to me about that is this is an enormously powerful educational tool that we physicians completely ignore. You're spending 2,000 hours connected to it. It could be an enormously powerful educational tool.
Of course, in public TV, we have always thought about media as education. Our motto is lights, camera, educate. We're not trying to sell you anything. But the media can't educate on its own. We need you. And doctors can't communicate without you. So from the producers of Second Opinion, we'd like you to know what we think of when we think of a second opinion. We need you, the intelligent and media-savvy audience, to know what it means to get a second opinion. To me, it means to be an informed patient, an informed consumer. Sure, Google all your symptoms, plow through WebMD, watch Dr. Oz on TV, but just know the sources of the information that you're reading and that you're watching and that you're learning about. Go ahead, click around, look for some scholarly articles. You can find them. Some of them are free online. Learn the words evidence-based medicine. You'll save yourself a lot of time if you do. And most importantly, don't let the health information overload keep you from telling your healthcare providers what you're thinking and what you're doing.
Absolutely. A second opinion to me, whether it's coming from Dr. Oz or somewhere on the internet or another doctor or your crazy Aunt Betty, whoever is giving you that second opinion, the least important part of that is the opinion. It's what led to that opinion that's most important. This is your healthcare we're talking about. So you should make sure that it's well evidence-based because it needs to be personalized to your needs and your principles. We need to be intellectual about our healthcare. We can't chase fads.
Thank you.
Very much.